The human hair structure is consisting of a root and a shaft, and its basic components are keratin and melanin. We've got 3 hair growth stages: anagen, catagen, and telogen. Hair growth stages repeat themselves in a cycle called the hair growth cycle. Anagen of the growing phase represents about the 85% of the scalp hair at any given time. Catagen about the 2% of the scalp hair, and telogen or resting phase about the 10% of the scalp hair. And these 3 stages repeat themselves. Hair loss symptoms are more than 100 hair fall a day, hair thinning, and hair breakage. The main factor for hair loss is the increase in DHT or dihydrotestosterone. Hair loss, family history, and genes are the main culprit. Increase in DHT or dihydrotestosterone in both men and women is a major risk factor for hair loss. The interaction of DHT with hair follicles is determined by our genes. This is why hair loss and balding runs in families. The hormonal process of testosterone converting to DHT harms hair follicles. DHT gets attached to the hair follicles and thereby triggers off miniaturization. This process is shrinking and thinning the hair follicle, making it progressively so fine and weak that it won't be able to regrow the hair. Other hair loss causes include stress, psychological factors, stress increasing adrenaline leading to production of DHT, or improper hair care, overstyling, smoking, and aging. In fact, the number of hair follicles decreases with age in both men and women. And finally, illnesses, hormonal dysfunction, medications, chemotherapy, poor diet, and so on. PRP is an autologous concentration of platelets 7 to 9 times above the baseline. Platelets triggers the healing process in the body and have a reservoir of growth factors that stimulate tissue recovery. The science behind platelet-rich plasma or PRP. Platelets are famed for stimulating and enhancing hair follicle operate. Indication of PRP for hair restoration: male and female pattern baldness, hair thinning, possible alternative to hair transplant, pre-hair transplant to increase success rate, post-hair transplant to promote healing, and preventative for patients with family history of alopecia. PRP for hair restoration is the gold standard therapy in the early stages of hair loss. Absolute contraindications are platelet dysfunction syndrome, critical thrombocytopenia, hemodynamic instability, septicemia, and local infection at the site of blood harvest or PRP injection. PRP hair growth advantages is very safe, effective, non-allergic emerging cutting-edge technology with the body's natural ability to self-repair. There are no long-term side effects, minimal downtime, only occasionally very short-term mild headache. Is a minimal invasive procedure requiring the injections only and very quick process, usually over within 60 to 9 minutes. The 3 steps of PRP injections preparation. First, the blood is drawn from the patient's arm. Second, the blood is centrifuged and the PRP is ready. Third, the PRP is transferred into smaller syringes to be injected into the scalp. Here we can see the syringes of PRP ready to be injected. The PRP is injected into the areas of the scalp that need increased hair growth. And here we can actually see the technique. Here the patient and the scalp has been previously numbed. And here the injections. So the PRP is injected through a very thin needles. The patient is quite relaxed. The procedure is very tolerable. Here are still few injections in the area of alopecia. And then there will be a follow-up in about 6 weeks. This was the first session for this patient. And she had great results after just 6 weeks. So here we can see the hair regrowth after 1 session just after 6 weeks. So excellent results. A full round of PRP therapy consists of 3 to 8 sessions. It can make your hair thicker, increase hair regrowth, arrest hair loss, and may last up to 15 months on average.